Have you noticed your dog drinking a lot more water than usual? Maybe they're asking to go outside constantly, having accidents in the house, or losing weight, even though they're eating normally, or maybe even more than usual. Or maybe your veterinarian mentioned the word diabetes, and now you're trying to understand what that actually means for your dog. If so, you're not alone. Diabetes in dogs can be confusing, especially because the early signs often look like normal day to day changes at home. Today, we're going to break down what diabetes actually is, why it happens, what to watch for, and how it's typically managed in dogs. I'm Dr. Matt Clark with Class and View Veterinary Clinic, and I'm here to help. This is Beyond the Vet Visit. Before we get started, I want to remind you that this video is intended for educational purposes only. Every pet is different, and the information discussed here should not be considered a diagnosis or a substitute for professional veterinary care. If your dog is drinking excessively, urinating frequently, losing weight, vomiting, becoming weak, suddenly seems ill, or any other abnormal symptoms, please contact your veterinarian right away. The goal of this channel is to help you better understand veterinary medicine so that you can have more informed conversations with your veterinarian and feel more confident caring for your pet. So, what exactly is diabetes? At its simplest, diabetes is a condition where the body has trouble regulating blood sugar. But to really understand it, we need to talk about a hormone called insulin. When your dog eats food, it gets broken down into sugar, also called glucose. That glucose enters the bloodstream and becomes a source of energy for the body. But glucose can't get into cells on its own. It needs insulin, which is a hormone made by the pancreas. You can think of insulin like a key. That key unlocks the doors to the body's cells so that sugar from the bloodstream can get into the cells and be used for energy. In dogs with diabetes, the system doesn't work properly. Most commonly, the body doesn't produce enough insulin. So even though there's plenty of sugar in the bloodstream, the cells can't access it. This results in two problems happening at the same time. First, you get high blood sugar in the bloodstream. Next, you get where you don't have enough usable energy inside of the body's cells. So the body is essentially starving while you have sugar build up in the blood. When blood sugar gets too high, the body tries to get rid of the extra sugar through the urine, but the sugar pulls water with it. This leads to increased urination, and because the body is losing so much water, the dog becomes thirsty trying to replace it. That's why the two most common signs of diabetes are drinking more and urinating more. Even though it looks like a kidney or bladder issue, the root cause is actually blood sugar imbalance. Here are some of the most common signs that pet owners notice when their dog has diabetes. Drinking too much water, or at least more than normal. They might urinate more frequently or start having accidents in the house. They might have weight loss despite normal or increased appetite. They, like we just talked about, might have some increased hunger. And despite that, they might be low energy or seeming slower than usual. Another thing you could see is that they start to develop some cloudy eyes over time because they start to develop cataracts. Sometimes the most obvious change is simply, my dog just doesn't seem like themselves anymore. I do want to make a note before we move on. Diabetes can sound really overwhelming at first, but with treatment and consistency, many dogs live very normal and happy lives. Your veterinarian may diagnose diabetes using a combination of things: examination findings, blood testing, looking for elevated glucose levels, urine testing, again, looking for glucose in the urine, or doing some additional testing to rule out stress or other conditions. One important note to make though, a single high blood sugar reading doesn't always confirm diabetes on its own. Context matters, and your veterinarian will interpret the full picture. In fact, your dog most commonly needs to have a blood sugar of over 250 to 300 in order to be considered to be diabetic. While numbers lower than this can be considered elevated, they are most likely due to stress or what we might call postprandial, or after eating, and not from diabetes. That being said, your veterinarian will be able to look at the full picture of your dog's testing and make the diagnosis of diabetes or not. It's also important to look at the glucose numbers in correlation with other blood work and urine values. Diabetes can cause liver issues, kidney problems, and a condition called diabetic ketoacidosis. All of these need to be treated or managed along with the diabetes itself. I also want owners to know that diabetes is frequently found when pets are showing signs of infection or other diseases. It's very common for a diabetic dog to present with urinary infections, abscesses, dental infections, or more. Again, these issues need to be resolved in order for the diabetes to be managed. Now, diabetes in dogs can develop for several reasons, including genetics, age, pancreatic disease, hormone conditions, obesity, and sometimes there's no clear underlying cause at all. Once your pet has been diagnosed with diabetes, the main treatment in dogs is insulin therapy. And unlike some humans and cats, which we'll talk about in a later episode, they're insulin dependent and generally not able to get off insulin. This usually means insulin injections are given once or twice daily, depending on the dog. While that may sound overwhelming at first, most owners adapt quickly, and most dogs tolerate it well. In my experience, many dogs quickly adjust to the routine and often associate it with something positive like food or treats. Along with insulin, management may include a consistent feeding schedule, a balanced diet recommended by your veterinarian, regular steady exercise, and ongoing monitoring at home and at the clinic. The goal is consistency. Most owners are surprised by how manageable diabetes becomes once a routine is established. You typically develop a rhythm with feeding, giving insulin, and maintaining a schedule. And many dogs continue to live happy, comfortable lives with this routine in place. It does require commitment, but it's very manageable with support from your veterinary team. It also requires following your veterinarian's instructions. Do not make changes in insulin, dosage, or treatment without consulting your veterinarian. Diabetes is not a set it and forget it condition. In fact, it can take multiple vet visits and tests to get the blood glucose properly regulated the first time. Don't get discouraged if you're asked to test or come into the vet multiple times early on in the diagnosis. Once regulated, your veterinarian will likely recommend regular rechecks, adjustments to insulin over time, or monitoring weight, appetite, thirst, and energy at home. This is a team effort between you and your veterinarian. Every veterinarian will monitor your pet a little differently. However, many veterinarians are now using continuous glucose monitors, like the Freestyle Libre system, because they provide detailed readings over several days and give a more complete picture of your dog's management. Another common method is using a fructosamine test. This test gives us a longer-term picture of blood sugar control over the past 2 to 3 weeks. Some veterinarians will do glucose curves, either in clinic or at home, where individual glucose tests are taken frequently over the course of the day to see how the numbers change. One note that I want to make: a single glucose number taken either at home or in clinic is not an acceptable method for determining whether your pet's diabetes is regulated. It is only helpful if you feel like your pet might be hypoglycemic or have low blood sugar, so that you can correct it. There are a few complications that we do want to monitor in diabetic dogs. The first is cataracts. These can affect vision. They usually occur commonly in dogs with diabetes, and it usually occurs within the first year, but not always. We want to keep an eye out for low blood sugar, especially if insulin is not balanced correctly. As we talked about earlier, we want to check with infections because they are very common for dogs who have diabetes also, so we want to make sure that we're not showing any signs of infection. Another thing we want to monitor for is a serious condition called diabetic ketoacidosis, which is an emergency. Ketones are acids that build up when the body can't use glucose properly. When they accumulate, they become toxic to the body and lead to the serious life-threatening condition called diabetic ketoacidosis, or DKA. Seek veterinary care immediately if your dog is weak or collapsing, vomiting repeatedly, not eating, or is extremely lethargic or unresponsive. Real quick, let's clear up a few common misconceptions. The first one is, my dog got diabetes from eating too much sugar. Luckily, this is not usually the cause. Their diets aren't as high in sugar as ours are. Another thing is, insulin cures diabetes. That's wrong too. Insulin manages diabetes, but it doesn't cure it. Unfortunately, we really can't cure the disease in most dogs. Another is, if my dog seems fine, I can skip insulin. That is a very important one to talk about. Consistency is critical, and skipping doses in your pet can be dangerous and can get them off track where they are no longer monitored and managed. The last one I want to talk about is, diabetes means my dog won't have a happy and good quality of life. Maybe it's just better to euthanize them. This is a big one too. Many diabetic dogs live a full, happy life with proper care and do not need to be euthanized just because they're diabetic. Diabetes in dogs can feel overwhelming at first. but it is often very manageable with the right treatment plan and support. The most important step is early recognition and working closely with your veterinarian. Do not make changes or decisions about treatment on your own without consulting your veterinarian. If your dog is showing signs like increased thirst, urination, or unexplained weight loss, don't wait. Have them evaluated. Your veterinarian can help guide diagnosis, treatment, and long term management. If you found this episode helpful, consider liking or subscribing for more educational content. And if there's a topic you'd like covered in a future episode, leave it in the comments below. I'm Dr. Matt Clark. Thank you for joining me for Beyond the Vet Visit, and I'll see you next time.